afternoon guys. Today we will be learning how to mobilize actively our wrist joint. So before mobilizing I would like to revise. There are 4 movements which are available at the wrist joint. First movement is flexion of the wrist joint. The second one is extension of the wrist joint. Then we have radial deviation of the wrist joint, and then ulnar deviation of the wrist joint. Following any fracture or immobilization, our patient encountered with post-operative or post-immobilization stiffness. So for that mobilization, you will be requiring is a medicine ball, which is a leather ball. In place of this particular ball, you can also use a leather ball which is available for cricket, also known as season ball. So for the first very movement, what we will be doing is, I have to grab hold my ball and then gently I have to grind it forwards. Please notice the movement which is occurring at my wrist joint. This particular movement is flexion of the wrist joint, and then for extension, slowly take the ball backwards. So this will be facilitating extension of the wrist joint. For the flexion, you have to roll the ball forwards. For extension, you have to roll the ball backwards. Similarly, for radial deviation and ulnar deviation, you have to move the ball towards your little finger, which will be showing you ulnar deviation. For radial deviation, you have to move the ball towards the thumb, which will be showing you radial deviation. For ulnar deviation, you have to move it towards your little finger. For radial deviation, you have to move it towards your thumb. So these are the basic 4 movements which are very necessarily to be performed while mobilizing the wrist joint. This particular exercise is relatively pain-free. However, I advise you to undergo hot fermentation or thermotherapy before starting with the exercises so that the wrist joint muscle loosens up.